Throat, mouth, lip, and tongue cancers used to be seen as a result of smoking and affected a small sliver of the cancer population. Now oral cancers are on the rise and it's HPV feeding its growth.
We weren't testing for HPV that long ago, and we didn't really understand that they were HPV-mediated tumors. They were just non-smokers who had throat cancer. Typically, prior to 15, 20 years ago, almost all throat cancers were related to smoking.
It's estimated 71% of new oral cancer cases are linked to the human papilloma virus, which also causes cervical cancer. As researchers look closer at HPV oral cancers, they're finding differences that affect patient survivability.
The main thing to us is that the HPV-caused tumors usually respond much better to treatment. They've got a better chance of cure.
Oral cancers fed by HPV are mostly diagnosed in people who have a lump in their neck caused by the growing tumor. They are, for the most part, less aggressive, which in turn has contributed to better treatment options.
We're actually seeing a lot less patients that need surgery today versus, say, 10 years ago.
Stacy Brill is a speech therapist with Lee Memorial Health System. She finds chemotherapy and radiation used to treat oral cancers today carry less long-term eating, drinking, and swallowing issues.
We get them in and get them going before they even start chemo, radiation, or have surgery, just to get baselines and to give them education and so forth. And then be able to plug them into therapy as soon as something is identified.
Greater awareness is feeding into a better understanding of HPV oral cancers, making them easier to manage and overcome. For Lee Memorial Health System, I'm Amy Osher.